the existing hair could be damaged by transplantation, especially likely to be accelerated is hair that's already miniaturizing. If you have a androgenetic condition, male pattern baldness or female pattern hair loss, and you're working in an area where there's a lot of hairs that are already on their way out, you can accelerate or hasten that progression of the hair loss. However, I've been, thickening up hair in thinning areas for a long, long time, having done many thousands of cases, and I don't find that the patients often complain. As a matter of fact, the last time I heard a patient complaining of shock loss was many years ago. So if we're careful in our procedures, employing sound hair restoration principles, it could be avoided. It's trauma by poor angling and direction, in the transplantation process. It can also be using too much like a vasoconstrictor in an area that's miniaturizing. I think that can also cause shock loss. So I think it's very important to do excellent pre-op instructions and for the patients to follow those pre-op instructions to minimize the thinness of the blood. Because if someone comes for a procedure where thousands of tiny incisions are necessary for the transplant, then each one of them has a propensity to bleed, and if your blood is thin, you're going to bleed more, and that makes it harder to see. Again, making it more difficult to avoid shocking the hair by hitting the roots of the adjacent hairs. I pull my own hair out when I have a patient that's bleeding a lot because I approach hair restoration surgery from an artistic vantage point. It's like I wouldn't dream of attacking a canvas blindfolded, and that's what you're doing when someone comes in and they're bleeding. It's very hard. You make an incision, it floods your field, and then you can't see what you're doing. We give everybody an extensive list of things that are avoid. Things as common as CoQ10, garlic, onions, curry. Sometimes vitamin E can stay in your body for many, many weeks because it's fat soluble. So you want to avoid that to ensure that you have a smoother day of surgery and that you get the result that you're looking for. It's going to be easier to work in between hair without damaging it if we can see what we're doing.